Thank you so much for clicking on our channel. Dr. Juliana Ome is the name, and if you're hearing my voice or seeing me for the first time or for another time, you're all welcome to our channel, and you know you're all special to me, right? And I love you all. I'm doing this for you, and I'm certain you'll be glad to be part of what we're doing here. So please watch till the end. The topic is 10 things every woman must do before pregnancy. The things I'm about to share with you are things some mothers wished that they heard before they became pregnant. Number 1, take your measles, mumps, rubella vaccine, MMR vaccine, before pregnancy. A child can be born blind, with big head, or be born deaf, or with low brain capacity, what we call mental retardation, and the child is unable to do what other children can do. These conditions are actually seen in a condition known as congenital rubella. And rubella infection is 100% preventable. So please just take the MMR vaccine. 2 doses are required. The first dose is at contact, and the second dose is just 1 month after the first dose. So you must complete 2 doses long before you become pregnant, because rubella vaccine is a live vaccine and it can cause side effect for your baby in the womb. This is what we call teratogenic effect. So the best time to take it is before you become pregnant, and then the immunity will be formed in your body, and then you transfer this immunity to your baby when you become pregnant. Point number 2, take hepatitis B vaccine. Hepatitis B infection can be transmitted from a mother to a baby during pregnancy through the placenta, and this infection is deadly. Remember that it even causes cancer of the liver. The best way to save your baby is to protect your own body by taking the vaccine long before pregnancy, so that you can just transfer this immunity to your baby during pregnancy. 3 doses are required. The first dose is at contact. The second dose is 1 month after the first dose. And the third and last dose is actually 6 months after the second dose. Then number 3 point is take your TT vaccine, tetanus, toxoid vaccine. If in your center you already have the TD, that's the tetanus and diphtheria together, that's also acceptable. So you just take your TD. 5 doses are required for lifetime immunity. Please note that TD is safe in pregnancy, so you can continue with the vaccine after you achieve pregnancy. Some people, for most persons, will have to take the vaccines only when they become pregnant. But why not start before you become pregnant? So the first dose is at contact. Second dose is 1 month after the first dose. The third dose is at least 6 months after the second dose. And the fourth dose will come at least 1 year after the third dose. And the fifth and final dose will come at least 1 year after the fourth dose. And then if you still need to become pregnant after your 5th dose, you can just take a booster during that pregnancy. Okay? Yeah. The next one is treat all sexually transmitted infections. The best place to keep a baby is a body without germs, without diseases. So while planning to become pregnant, please get yourself and your partner treated of all infections and diseases. That vaginal itch, that discharge, don't manage it, because it may become worse when you become pregnant. Get them treated, okay? And your partner too should be treated. Then point number 5, please check your blood sugar level. Diabetes is a common disease in our world, and the test required to check for diabetes is a very simple test. Once the blood test shows that your sugar level is high, you see your doctor and make sure that you normalize your sugar level before you become pregnant. This is important because there are many consequences of uncontrolled sugar level, both to the mother and to the baby. So please get to watch the health talk I did on diabetes and pregnancy, so you will learn more, okay? The 6th one is check your blood pressure before you become pregnant. High blood pressure is a silent killer. And what this means is that someone may be suffering from high blood pressure, hypertension, and be normal. So you have everything to gain and nothing to lose by checking your blood pressure before pregnancy. One of the commonest complications in pregnancy is related to high blood pressure. And there's a complete health talk on this topic on my channel. Please get to watch it. And I want to state something. Please, irrespective of how old you are, maybe you think you're a young woman, you're just 21, you can just get pregnant. Please get to do all of this. Prepare properly and you will enjoy your pregnancy period. Number 7, do hormonal tests for diseases like thyroid, so that you be sure that you have normal hormone levels before you get pregnant. And this is very important, especially if a woman already has some conditions like thyroid disease. So please check and be sure that you are all right before you get pregnant. Number 8, and very important, check your HIV status. Check yours and check that of your partner. Because if you're HIV positive, it's not a death sentence. You can live a normal life. So please, before you achieve pregnancy, check your status. If you are positive, there are ways to actually have HIV as a mother and deliver HIV negative babies. Okay, so please, the best time to prepare to achieve this beautiful thing is long before you get pregnant. Once you and your partner check your HIV status and you're positive, please, there are ways to go about. Check my channel again for this particular health talk. You will learn so much. Number 9, start taking your folic acid tablets, 400 microgram every day before you get pregnant. This singular act will help your baby during the first few weeks of pregnancy when the baby's brain is forming. While you do this, please do well to eat balanced diet, because folic acid will help to prevent what we call neural tube defects or spinal bifida. Okay, so please eat well, maintain a normal weight for your height, eat balanced diet, quit smoking, and reduce alcohol intake so you have a clean system for your baby. Before I get to the next point, I want to plead with you to please subscribe to this channel. If you think there's value here and you're getting something, please subscribe to the channel, like the video, and share so that as much as possible we can together share the information. Remember, it's our channel, and for me to keep coming on this platform, you need to subscribe and make me know that you're here for me, right? Thank you so much. Now, number 10, check your account balance. Please call your account officer. Make sure you have some money to take care of yourself and your baby. Now, in normal circumstance, childbirth is not an emergency. Pregnancy gives you 9 months notice. In some part of the world, you pay from your pocket, out-of-pocket payments with your own money, where a patient is not attended to until payment is made. So if you're in that part of the world, you have to make everything available. You have to be ready to pay the bills, from antenatal care to delivery to buying baby's items. And the best time to get ready is when you're not pregnant, just you alone. You're not having all the problems of pregnancy, just you in your very healthy, strong self. Please do all you want to do, all the nice hustles, very legal hustles, and get some money saved for pregnancy. You can target pregnancy projects. Open an account, target pregnancy projects, and put in some money consistently. Put away some money and get ready for childbirth and for pregnancy. So before the lovey-dovey, the fantasies about new parenting, please get this 10 things ready. Just check off the boxes and be ready. Once again, Dr. Juliana Ome reporting for duty. I love you all, and I remain your favorite health personnel on YouTube. Thank you very much, and see you again.